everyone, today we'll talk about intradermal injection, ID. By the end of the section, you should be able to first describe the concept and purposes of ID. Second, identify the common sites used for ID. Third, verbalize and practice the skill of ID in the laboratory safely. The term intradermal injection is an injection administered into the dermis just below the epidermis. It's frequently used for allergy testing and tuberculosis screening. As shown in this picture, the common injection sites used are the inner surface of the forearm, the upper chest, and the back beneath the scapulae. Among them, forearm is the most common site used for allergy testing and TB screening. Today, we'll use allergy testing as an example and go through each step of intradermal injection. Patient preparation and assessment are similar to other routes of injection. First, we need to assess the patient's condition, treatment options, medical history, allergy history, and family history. Assess patient's mental status. Second, get close to the patient and understand his or her knowledge base and learning needs about medication. We should provide detailed information about injection routes, specific drug actions, and precautions. Because this part of the skin is rich in sensory receptors and nerve endings, patient will feel more pain during the intradermal injection. So we will explain this to our patient before starting the procedure. Third, inspect and choose appropriate injection site that is free from lesions, rashes, scars, or ulcers. Now, let's discuss the essential items. We need to prepare the patient's medication administration record, MAR, medicines, 75% alcohol, antiseptic swabs or alcohol swabs, a tray, a syringe, needles, a piece of gauze, an ampule opener, a vial opener, non-sterile gloves, a kidney basin, hand sanitizer, a biohazard bag, and a sharp container. Because the dosage of an ID injection is usually small, we should choose a 1 ml syringe and a 25 to 27 gauge needle. Chinese standard is size 4 to 5. In addition, we must prepare epinephrine in case of anaphylactic reaction when we do allergy testing. Now we go through the procedure. 1. Review the MAR and prepare medications. 2. Perform hand hygiene and gather all the supplies. 3. Draw up the correct medication dose aseptically in a syringe. Check the patient's identity and explain the procedure, medication, and precautions to reduce the patient's anxiety. Then select appropriate site for administration. The most common site used is the inner surface of the forearm, about 3 to 4 fingers width, below antecubital space, and 1 hand width above the wrist. Perform hand hygiene again and wear the gloves. Ask the patient to extend his or her arm and disinfect the injection site with alcohol swabs. If the patient is allergic to alcohol, you can clean his or her skin with normal saline instead. Correct manipulation is very important to reduce patient's pain and facilitate successful injection. You need to spread the skin taut with your non-dominant hand as the picture shows. Then insert the needle slowly, bevel up with a 5-degree angle until the bevel is just under the epidermis. Then inject 0.1 milliliter of the solution, and you will see a small wheal on the skin surface. Now imagine that we insert the needle at a deeper angle. What will happen? Yes, the fluid would penetrate to the subcutaneous tissue, and we could hardly see a bleb. As a result, we may get a false reading. Here I have another question for you. Why do we need to keep the bevel up when we insert the needle? Yes, it allows for smooth piercing of the skin so that we can inject easily. In fact, if we search for the evidence of bevel up and bevel down injection, we found that different studies show different results. Most articles show that bevel up is more comfortable and significantly faster, while a few reports state the opposite. Thereafter, you will withdraw the needle. Please remember to instruct your patient not to massage the injection site. Massaging may spread the solution to the underlying subcutaneous tissue. You can draw a circle around the injection site in order to see the spots more easily, especially for TB screening. Because we need to read the results after 48 to 72 hours. Let's go to look at this video. Nine, check again. Monitor the patient for adverse drug events such as difficulty breathing. Then discard the supplies properly, remove the gloves and perform hand hygiene. Reassess the patient 20 minutes after administration for allergic reaction. And the last step is documentation. Document the procedure and findings and know the result of skin test. If the result is positive, you need to inform the patient and his doctor. Write down the result on the wristband, bedside card, and patient's chart or record according to the hospital policy. So far, we went through each step of intradermal injection. Then we'll evaluate the patient's response. We know that close observation plays an important role during the procedure. How do we observe the results for allergy testing? A local and typical reaction looks like a small hive with swelling and redness. Besides, anaphylaxis is real, but it needs to be monitored and treated immediately. It can cause severe symptoms such as difficulty breathing and hemodynamic instability. Epinephrine is the most effective treatment for anaphylaxis. That is why we must have this medicine on hand. Finally, let's review the procedure, and I'll summarize the key points of intradermal injection. 1. Check appropriate needle gauge at 25 to 27. 2. Spread the skin taut. 3. Keep the injection angle at 5 degrees. Do not massage the site after injection. And please remember, careful observation is the most important part. That's all for today's section. Here are the references. Thank you and see you next week.